This is the north of Syria, in an opposition-held region. Here in this displaced persons camp not far from the Turkish border, medical needs are huge and aid clearly lacking. MSF is working inside Syria, where it has opened 3 hospitals. The teams also supply drugs and train Syrians who give first aid to the wounded near the front line. Just a few months ago, these men had no medical knowledge whatsoever. During short visits, MSF emergency doctors demonstrate and explain basic but essential skills.
How to give oxygen, administer a simple transfusion, stop severe bleeding, apply a splint to a fracture, administer a first dose of antibiotics in the case of an open fracture, how to treat burns.
The majority of international humanitarian aid is being implemented from the capital city, Damascus, and distributed to areas under government control. As conditions worsen for some 7 million Syrians still living in opposition-held areas, international aid is minimal. In response to the needs in these zones, MSF is asking donors to also support cross-border humanitarian operations. We are in the west of Lebanon, in Bekaa Valley. Winter has set in and the Syrian refugees living here in tents and temporary shelters are battling with the cold. Their living conditions are very poor. Humanitarian aid is woefully inadequate and their health is in danger.
Water's coming out from the floor. It rained during the night, and in the morning I found this much water. I live here with my husband and his parents, and I'm currently 1 month pregnant. The cold isn't good for me.
According to the findings of a study conducted by MSF in May 2012, over half of the refugees are living in insalubrious shelter with no access to the healthcare they so badly need.
Due to the bad weather and the living conditions of the families with little heating, we're mostly witnessing lung infections and respiratory tract infections, which we provide medical care for. Lately, due to the very cold weather, most of the cases are children with high fever and infections. We're also seeing patients with asthma and allergy cases that are also identified and treated.
The MSF teams working in Tripoli and the Bekaa Valley are doing everything they can. They provide free healthcare and give out blankets and fuel so that people can keep warm. In spite of all this, the medical facilities are often overwhelmed. MSF continues to ramp up its activities in the country. MSF teams have remained in the north of the country throughout the crisis, including during the military offensive, in order to provide the local population with at least some access to healthcare. Medical and surgical care projects have been able to treat people wounded in the shelling in Timbuktu, Douenza and Ansongo, and a team arrived in Kona at the end of January.
On our first visit, we were a team of 4 doctors and nurses, and we had medical kits so that we could treat people.
MSF has been running operations in the north of Mali since January 2012 and has been working in the paediatric, surgical and obstetric departments at the hospital in Timbuktu.
In the past few weeks, MSF has treated 35 wounded patients in Timbuktu. In response to the number of people fleeing the conflict, MSF is also running programs in refugee camps in Mauritania, Niger and Burkina Faso.
We are treating this child as quickly as we can to try and save her. She is severely dehydrated and in shock.
Dr. Gilles Coupeau and his team are in a real race against time. MSF has been treating patients in the facilities that it supports since the start of the measles epidemic last October. But patients, often from remote communities, arrive at the hospital when it is already very late.
To respond to a measles epidemic, uncomplicated and severe cases need to be treated and preventative actions implemented, immunisation being the most important. We need to be able to treat patients as early on as we can. They don't get treated quickly enough. When serious cases arrive at the hospital, we don't have the life-saving drugs we need to treat seriously ill children.
The health system does not have the means to tackle the emergency. Healthcare services are all too rare and patients are unable to pay for them. Given the size of the area that is affected and the remoteness of its inhabitants, MSF has deployed major logistical support to treat 16,000 patients and vaccinate close to 340,000 children. So long as the epidemic prevails, the teams will be on hand to provide assistance.